Hello, my name is Savannah. I have my patient here today. He came in for prophylaxis and he marked that he smokes tobacco on his medical history, so we're just going to kind of look into that a little bit more. All right, patient, I see that you marked that you smoke tobacco on your medical history.
Mhm.
Can you explain that a little bit more?
I usually smoke with my coworkers. I don't know, maybe like 4 or 5 cigarettes a day, I'd say. It's not really outside of that. It's mostly just at work.
Okay. Do you smoke at all outside of work, like at parties or anything, or is it just with your coworkers?
No, it's just mostly with my coworkers.
Okay. Um, so that being said, do you feel like you're addicted to it at all, or just kind of a thing that you do? Do you think it'd be easy to quit?
I don't know. It's such a social thing for me that, like, when I'm not doing it, I don't know if I could not do it. You know what I mean? Like, I'd have a hard time with that.
Okay. So I'm just gonna kind of go through a few things with you, and then we can discuss after that what we're thinking. Okay. So obviously I'm not a doctor, so I can't really go into how it affects your whole body. But some concerns I have as an oral care provider is that obviously we all know it's cancer causing. So even though you're only doing it while you're at work, those 5 cigarettes do add up like throughout the day and throughout the week, affecting your body and the way blood flows throughout your body, because it's a vasoconstrictor. So if your blood vessel's like this normally and then you squeeze down on it, blood is not properly getting to places it needs to be. So my concern with the oral cavity is that you're not getting the proper blood flow that your teeth and bone need to fight off infection and regenerate itself to stay healthy. Some concerns I see as well is that your mouth has like a white film around it, and that can also be early signs of cancer as well. So at the end of the day, it's your body and your choice, and you can do whatever you choose to do. I just really want you to be aware of the things that I'm seeing and the concerns I have, and I'm just trying to advocate for your health. I don't know how you feel about that at all.
I mean, obviously, I know that smoking is bad. It's just that it's gonna be hard to give up just because it's so social for me. I mean, I've thought about trying the nicotine patches. I don't know.
Okay. Yeah. How often are you seeing your primary care provider? Are you doing like an annual visit at all, or are you kind of skipping those?
Yeah, it's kind of intermittent whenever I need to. Not very
Okay.
often though.
Cool. Yeah, ideally you do want to do an annual physical just to get checked up. If this is something you're truly interested about quitting, I would recommend going to a primary doctor, and kind of assessing if they want to give you medication. Another thing that really helps people with smoking is cognitive therapy, which again you can talk about with your primary doctor. Minnesota.gov does have a what's it called? The Quit Partners program, where they kind of work with you. There's different groups and chats and emails and stuff like that that you can use to help yourself quit. Sometimes people who are just social smokers, that's enough, but sometimes going the more invasive therapy route is more effective as well. The nicotine patches can be very helpful. Again, might be worth talking to your primary doctor about. Another thing is smoking also can be hard for people with oral fixation, so people who like want to be constantly chewing on something or have something in their mouth. Chewing gum in general, whether it's the nicotine or just like a sugar-free gum, could be really helpful for that as well. Does any of that sound helpful at all?
I mean, I'll have to think about it because I don't know. It's gonna be tough, like I said. But yeah, I guess I can give it a shot and see how those go. Because I mean, there's obviously ways to quit, and obviously it's not good for me, so I probably should. So
Yeah. Out of everything I recommended, what do you think would be most obtainable? Whether it's going to your primary doctor or going to the quitting partners for Minnesota.gov. Just so we kind of have a plan in place.
I mean, at this point right now, like, I don't know if I'll go to all that stuff, but maybe I'll try the nicotine patches because I know they work for some people.
Okay. Sounds good. Well, I think this is still new to you and it can be kind of hard. I know it's a big switch. I'll call you in about a week. I'll see how everything's going. If you've tried the nicotine patches or made an appointment with your doctor, I would recommend seeing your doctor before starting a nicotine patch, just because adverse reactions and stuff like that. But anyways, I'll give you a call in about a week here, see where we're sitting, if you're experiencing any roadblocks at all, and then we can go from there if we need to change things up or a little bit of encouragement. I also, in your baggie, I put in a brochure as well that has a lot more information as well on the subject, okay?
Okay.
Alright, sounds good. High five. I wish you luck.